So now we are going to discuss your CBT-2 pathology questions. So let us start. So the first question that was asked from me was that I have a 35-year-old male presenting with high-grade fever, no lymphadenopathy. A bone marrow examination was done and it was showing dysplasia in the myeloid, yani ki neutrophilic lineage, and similar blast count of, yes, similar blast count of 12%. A cytogenetics shows that the blasts are carrying a 821 translocation. What is the likely diagnosis? Now we all know that to be labeled as a case of acute leukemia, your blast count should be more than 20%. So अगर मुझे acute leukemia बोलना है, acute myeloid leukemia, so उसके लिए blast count should be more than 20%. This was criteria given to me by the WHO. But there are, I always tell this, that there are some exceptions to these criteria. And what are the exceptions? These 3 translocations are actually the exceptions to this criteria. Number 1, translocation 821, translocation 1517, and inversion 16. And inversion 16. Right? So these are the exceptions. कहने का मतलब है अगर इन तीनों में से कोई एक भी दिख गई मुझे translocation, I will straight away say that I do not care about the blast count. Even it is less than 20%, still I am going to label my patient as a patient of acute myeloid leukemia. And question is straight away telling me 12% blast count but 821C. तो इसका मतलब I do not care. I will straight away say that yes, this is going to be my clear-cut case of acute myeloid leukemia. Now, if I'm talking about the genetic changes, I want to take the opportunity here, make the maximum use of it, and tell you कि जो बाकी options आपके पास हैं, उनमें कौन सी classical genetic changes, mutations, translocations आपको दिखती हैं. So I want to talk about that. So if I say myelodysplastic syndrome, you're going to have monosomy 7 classical, monosomy 5q, and monosomy 20q. CML, a very classical, you have 922 translocation, जिसकी वजह से you have Philadelphia chromosome formation, right? If I talk about Burkitt's, a classical 8. If you see B, you see chromosome 8. So 828, 814, 822, the common chromosome. और इन तीनों translocations की वजह से इन लोगों में क्या होता है? I have increased c-MYC proliferation, right? Hell lot of tumor proliferation is going to be seen in your Burkitt's lymphoma, right? Okay. Now, moving ahead to the next question. Next question says, a patient is found to have granulomatous lesion in lungs and crescentic glomerulonephritis. Which of the following antibodies will be seen in this case? I am seeing lesion in lungs and with crescentic glomerulonephritis. This is a case of vaginous granulomatosis, and I know vaginous granulomatosis is C-ANCA mediated, and C-ANCA का दूसरा नाम क्या होता है? This is, yes, PR3 ANCA, यानी कि this is going to be my anti-proteinase 3. But again, if I look at the rest of the options, I want to see कि बाकी antibodies मुझे कहाँ मिलेंगी. So anti-LKM1 is going to be seen in autoimmune hepatitis type 1. So type 1 autoimmune hepatitis, sorry, type 2 autoimmune hepatitis, and anti-SMA, यानी कि antibody to smooth muscle actin, that is going to be seen in type 1 autoimmune hepatitis. इसके अलावा और कौन कौन सी मिलती हैं type 1 में? I also see ANA, and I also see antibody to soluble liver antigen. इसके अलावा these are also seen in patients of type 1 autoimmune hepatitis. Now, if I tell you that C-ANCA, which is an anti-proteinase 3 antibody, that is seen in vaginous, but what about the other ANCA? That is your P-ANCA. And another name for P-ANCA is, yes, MPO-ANCA. ये कहाँ मिलेगी? It is going to be seen in your microscopic polyangiitis and your classical Churg-Strauss syndrome, right? So this was your question. Now, moving ahead with my next question. A 2-year-old child presents to you with scattered permeating lesions in the skull. Electron microscopy has revealed the following image. All are positive in this condition. Question देखिए, except कौन सा नहीं है? तो ये जो image मेरे सामने है, a very classical image. This is an electron microscopic image in front of me, and I see what? I see tennis racket shaped. Yes, I see classical tennis racket shaped Burbeck granules. So मुझे classical tennis racket shaped Burbeck granules मिल रहे हैं, यानी कि this is a classical case of Langhans cell histiocytosis, LCH. And I know LCH, what are the IHC markers for LCH? They are CD1A positive, CD207 positive, और CD207 का दूसरा नाम होता है Langerin. CD207 का दूसरा नाम होता है Langerin. So they are CD207 positive and they are S100 positive as well. So कौन सा है जो positive नहीं होता? That is CD19. CD19 is negative. 207, also called as Langerin, 1A, S100, they are going to be positive. So here exception was asked. So correct answer is going to be option B here. With my next question. Again, a very easy, straightforward question. Which factor deficiency will not affect in vivo coagulation but affect in vitro? In vivo means body के अंदर coagulation pathway is not going to be affected अगर ये factor नहीं भी है तो, लेकिन हाँ laboratory में in vitro में coagulation is going to be affected. Which factor I am talking about? Yes, your factor 12, because your body does not need factor 12 for coagulation pathway. So if factor 12 is present, body को कोई फर्क नहीं पड़ने वाला coagulation pathway में. But yes, in vitro 12 is very important. So correct answer is option D. Moving ahead to my next question. True about healing are all except, मुझसे पूछा गया है कौन नहीं है. चलो देखते हैं. Maximum neovascularization is seen on day 5. Absolutely true statement. Epithelial regeneration begins on day 4. No, that is a false statement because it begins within 24 to 48 hours. और सबसे ज़्यादा कब होती है? 5th day पे, right? But let's see the rest of the options. Platelets are first cell of wound healing. Absolutely true. Maximum fibrosis is by 3 weeks. Absolutely true. So here my correct answer is option B. लेकिन एक बार फिर से important future questions MCQs देख लेते हैं. क्या क्या important landmarks आपको याद रखने हैं. I told you epithelial regeneration starts within 24 to 48 hours and is going to be completed by 5th day. Clot formation within 24 hours शुरू हो जाता है. Neutrophils they start appearing on day 1. Granulation tissue 3 to 5 days. 3rd day पे शुरू होगा और maximum होगा 5th day पे. Maximum fibrosis 3 weeks and maximum strength is 3 months, right? So these are the important landmarks healing that I want all of you to remember. Next question. Straightforward question. In blood preservatives CPD SAGM, which of the following increases the shelf life by increasing ATP production? सीधा question है. ATP कौन बढ़ाता है? हाँ जी, ऑप्शन सी एडेनिन. बट अगर बाकियों की बात करूं मैं रेस्ट की, तो सिट्रेट क्या है? कैल्शियम चिलेटर होता है. इट्स अ कैल्शियम चिलेटर एंड इट्स एन एंटी कोएगुलेंट एज वेल, राइट? फॉस्फेट का फंक्शन क्या होता है? इट इज अ बफर एंड इट इंक्रीजेस द 2,3 DPG levels in the stored blood. And if I talk about the dextrose क्या करता है? It provides nutrition to the cells, right? So with this, I am done with this question. Correct answer is C here. Next question. A patient presents with epistaxis and multiple petechias. Bleeding time is prolonged. Platelet count is 3 lakhs. Platelet function test showed absent aggregation to ADP and collagen. However, aggregation was present with ristocetin. Which of the following is correct about the disease? So, bleeding time is prolonged, petechias मिल रहे हैं, so superficial bleeds हैं, that means sure shot it's a platelet disorder. But the count is normal, so that means it's not a number disorder, it's a platelet function disorder. And I know there are two important platelet function disorder, Bernard-Solier syndrome and Glanzmann thrombocythemia. But the question is particularly telling me that RIPA, ristocetin induced platelet aggregation, is absolutely normal here. So RIPA is completely normal. So that means I'm ruling out that there is some adhesion defect. Adhesion defect नहीं है क्योंकि RIPA normal है. So यानी कि with this I rule out my Bernard-Solier syndrome, which is an adhesion defect. वो नहीं हो सकता. Question is specifically telling me there is absent aggregation to ADP. यानी कि this is a platelet aggregation disorder. यानी कि I'm talking about Glanzmann thrombocythemia. And Glanzmann thrombocythemia is which GP defect? Yes. It is a GP2B3A defect. So correct answer is option C here. It's a Glanzmann thrombocythemia GP2B3A defect. Next question. Match the following columns. Okay. First is Cabot ring. Cabot ring क्या होता है? It's like this. It's a figure of 8 appearance. This is nothing but a DNA remnant. So it is 1 is going to be 5. You see this in megaloblastic anemia, right? So 1 का 5. तो ये कटा और ये कटा. Next. Heinz bodies. What are Heinz bodies? They are nothing but a denatured globin. Denatured globin gets precipitate in the RBC. अगर इस तरह से RBC है तो globin जो है वो precipitate हो जाता है RBC में, and this is what you call as Heinz body. So this is your 2 का 1. So here my correct answer is option C here. ठीक है, इतने से हो गया, but still let me complete it. What about Pappenheimer bodies? Pappenheimer bodies are the excess iron deposits that you see in the RBC. So this is going to be 4. और Pappenheimer bodies कहाँ मिलती हैं? Sideroblastic anemia में मिलते हैं, right? Heinz bodies कहाँ मिलते हैं? G6PD deficiency. And Heinz body, इसके अलावा G6PD में और क्या मिलता है Heinz body के अलावा? Yes, you also see the bite cells. Apart from that, you also see the bite cells as well. Important findings. ठीक है, चलते हैं आगे. Next question. Which of the following arachidonic acid metabolites is anti-inflammatory in nature? Yes, we all know that there is a derivative of LOX pathway which is totally anti-inflammatory in nature, and yes, I'm not talking about leukotrienes, I'm talking about lipoxins. Lipoxins are totally anti-inflammatory in nature. But the next question is, how do they cause anti-inflammation? So lipoxins, they suppress inflammation by inhibiting the recruitment of the leukocytes. ये क्या करते हैं? ये inhibit करते हैं न्यूट्रोफिल की कीमोटैक्सिस को और उसके एंडोथेलियल एडिशन को. सो अगर न्यूट्रोफिल का कीमोटैक्सिस नहीं होगा, एडिशन टू द एंडोथेलियम नहीं होगा, सो वो सारे इवेंट्स ऑफ इन्फ्लेमेशन पूरे नहीं हो पाएंगे. दैट्स व्हाई दे आर एंटी इन्फ्लेमेटरी इन नेचर, लाइपोक्सिन्स. ओके, नेक्स्ट क्वेश्चन. It's a very, very important question. A 10-year-old child presents with bleeding per rectum. Colonoscopy shows a polyp and histology is shown below. Which of the following mutation is likely to be seen? फोटो देखिए, फोटो कितनी क्लासिकल फोटो है. हाँ जी, क्या दिख रहा है? Yes, I have a arborizing pattern और Christmas tree pattern. Arborizing network का मतलब क्या होता है? You see that your muscle is trying to separate your glands. ये आपके सारे glands हैं और आपकी muscle glands को separate करने की कोशिश कर रही है. This is a classical arborizing network और Christmas tree pattern. where your pink muscle is trying to separate your glands, and this is a classical feature of, yes, PJ polyp, यानी कि I am talking about Peutz-Jeghers polyp here. And Peutz-Jeghers syndrome में which mutation you see? Yes, this is your STK11, option number B, STK11 or LKB1 gene mutation. Classical STK11 or LKB1 Peutz-Jeghers, so correct answer is option B. But if I look at the rest of the options, APC से क्या होता है? APC causes FAP. MSH से क्या होता है? Yes, HNPCC. Another name for HNPCC is what? Lynch syndrome. This is MSH is what? This is a MMR gene, right? What about P53? P53 was involved in the adenoma carcinoma sequence of the polyp. Okay? So this was all about your rest of the options as well. Now moving ahead to my next question. Question number 11. A 15-year-old boy is having long-standing diarrhea. Biopsy from upper intestine is as follows. Which of the following is treatment and possible complication in this disease? Again, a straightforward clear-cut biopsy. क्या intestinal biopsy में आपको इस तरीके से यहाँ कुछ दिख रहा है? Means basically, do you see villi here? No, I do not see. That means villus atrophy must have happened. Villus atrophy means this is a clear-cut case of celiac disease. And celiac disease is what? It is a gluten sensitive enteropathy. So that means what I'll tell the patient कि patient please have a gluten free diet. So ये तो कटा. तो मुझे 3 ऑप्शन में ग्लूटेन फ्री डाइट दिख रहा है, लेकिन मुझसे अगला सवाल क्या पूछा? व्हाट इज द पॉसिबल कॉम्प्लिकेशन? सो वी ऑल नो दैट celiac disease patients, yes, they do have a risk of developing lymphoma in future. So correct option is option B here. But next important question for you, which lymphoma? Is it a B cell lymphoma or a T cell lymphoma? So please remember, they have a risk of developing classically enteropathy associated T cell lymphoma. Enteropathy associated T cell lymphoma, right? Okay. Now moving ahead to your question number 12. The following karyotype belongs to. तो चलो सीधा karyotype देखते हैं. क्या मिल रहा है मुझे following karyotype में? Yes, I see a classical trisomy 22. यानी कि this is a clear-cut diagnosis of cat-eye syndrome. Yes, eye syndrome. So this is a clear-cut diagnosis of cat-eye syndrome. So correct answer is option C. But if I look at the rest of the options, Cry-do-chat. Cry-do-chat का दूसरा नाम होता है cat-cry syndrome. This is your 5P deletion, right? But if I talk about Edward is what? It is trisomy 18. What is Patau? Patau is your trisomy 30. ठीक है? चलो. Moving ahead to the next question. Again, a very simple, easy, straightforward. Porcine, pig का cardiac walls transplanted to humans is which type of graft? So मतलब अगर species ही बदल दी, that is your xenograft. Correct option is answer C here. Correct is answer C. But अगर बाकी grafts के बारे में मैं देखूं, so I have different types of graft. Allograft का मतलब क्या होता है कि same species, यानी कि आप और मैं हैं, आप मुझे graft दे दें. Means genetically non-identical हैं आप और मैं, लेकिन हैं हम same species से. So that is allograft. Autograft means मैं खुद को ही दूं within the same individual. Classic example is split skin grafting within the same individual. Xenograft, different species. Example, pig से उठाया, human को लगाया, porcine cardiac graft. Isograft, iso का मतलब क्या होता है? Same. So this is going to happen in not just देखने में same, genetically भी same होना चाहिए. So this is going to be same in genetically identical twins. यानी कि I am not talking about dizygotic, I am talking about monozygotic identical twins, जिनका genetic material भी same हो, उसे हम बोलेंगे isograft. ठीक है? तो ये थे important grafts जो आपको पता होने चाहिए. अगला सवाल. Next question. A patient who worked in the shipping industry presents to me with प्लूरल प्लाक्स. प्लूरल प्लाक्स क्या है? इट इज द मोस्ट कॉमन प्रेजेंटेशन ऑफ अ पेशेंट विद विच एक्सपोजर? यस, asbestos exposure. Now findings are shown in the following picture. Which of the following is the most, ध्यान से पढ़ेंगे क्या पूछा गया है, most specific complication of this condition. वैसे तो मुझे पता चल गया था, बट ठीक है, ब्राउनी पॉइंट्स की मुझे फोटो भी दी गई है, मुझे इमेज दी गई है, और ये जो इमेज मेरे सामने रखी गई है, दिस अ वेरी क्लासिकल इमेज, क्योंकि इस इमेज में मुझे क्या दिख रहे हैं, ब्राउन कलर्ड बीडेड अपीयरेंस ऑफ asbestos body. Brown colored beaded appearance of asbestos body. यानी कि I am talking about more specific complication of this asbestos patient, and we all know that the most specific cancer that is associated with asbestos exposure is mesothelioma. Yes, and lung carcinoma is the most common carcinoma that is associated. अगर मैं TB की बात करूं, so increased risk of tuberculosis is going to be seen in patients of सिलिकोसिस, और ये जो मोस्ट कॉमन है ये एस्बेस्टोस के साथ ही एसोसिएटेड है. ठीक है, सो हियर माय करेक्ट आंसर इज ऑप्शन सी. नाउ नेक्स्ट क्वेश्चन, मैच द फॉलोइंग. ओके, आई हैव टू मैच द ट्रांसलोकेशंस. तो चलो करते हैं. नंबर 1, बर्किट लिम्फोमा. आई नो बर्किट इज व्हाट, बर्किट इज योर 814. सो ए का हो गया 3. सो दिस इज गॉन, दिस इज गॉन. लेट्स गो अहेड. Follicular lymphoma, it is 1418. So B का हो गया 1. Again, third and fourth are going to determine now. Mantle cell lymphoma is what? 1114. So C का हो गया 4. Anaplastic lymphoma is going to be 25. That is 2. So 3142. यानी कि my correct answer is option A here. ठीक है, चलो. Moving ahead with my last question. Match the following. So I have been asked amyloids here. तो चलो, number 1, medullary carcinoma of thyroid में क्या होता है? ACAL, where CAL stands for calcitonin. So A का हो गया 3. तो ये कटा और ये कटा. Next is multiple myeloma. Multiple myeloma में क्या होता है? AL, where AL stands for light chain. So B का हो गया 4. Okay, I know the answer is going to be this, but still let me complete it. Alzheimer's में क्या होता है? 1 A बीटा. फेमिलियल मेडिटेरेनियन फीवर में होता है 2, that is A. Right? So this was all regarding your all the important pathology CBT questions.